Georgia's ever-expanding healthcare field is made up of healthcare IT and management professionals, physicians, allied healthcare professionals, and hospital administrative personnel. It's an entire industry where Georgia leads, focused on rapid advancements in healthcare technology that have had enormous impact. Greetings, everyone. It's Tuesday, November 4th, 2014, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. Mark your calendars. It's the 5th Annual Health IT Leadership Summit this November 20th. Created in 2010 by the Georgia Department of Economic Development, the Metro Atlanta Chamber of Commerce, and the Technology Association of Georgia Health Society, today the Health IT Leadership Summit brings together leaders from across the healthcare ecosystem to discuss how the industry can drive innovation to navigate better health and healthcare delivery and lower costs to more people. Up to the Tech Talk, Dr. Turner Smith, chairman of the 2014 Health IT Leadership Summit. Dr. Smith was responsible for market development as well as domestic and international medical device regulatory compliance at Rubbermaid Healthcare. He previously held the position of VP Healthcare Solutions at Seaport Solutions in Atlanta. His prior business background includes psychiatric hospital clinical services and operations, as well as community mental health administration. Currently, he sits on the board of directors of the Technology Association of Georgia Health Society, and beyond being this year's chairman for the annual Health IT Leadership Summit, he's a member of the Health IT Subcommittee and Public Policy Task Force of the Bioscience Leadership Council at the Metro Atlanta Chamber of Commerce. Dr. Smith has presented at the American Telemedicine Association annual meeting and also served on the special working group for the Georgia Department of Education, which is developing the curriculum for the health science cluster to align with the federal career clusters and pathways. It's a Tech Talk focus on the one event that has become the premier Health IT Leadership Summit in the Southeast. From some of the outcomes over the years to its long-term mission, who should participate and why? Join us for some last-minute highlights as the momentum builds towards what promises to be the biggest and best Health IT Summit in its 5-year history, as we speak with the chairman of the 2014 Health IT Leadership Summit, Dr. Turner Smith. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Turner, welcome to Tech Talk.
Thank you, Frank. It's a pleasure to speak with you today.
I know many of our members of the Technology Association are so aware of the Health IT Summit and the powerhouse that it's grown over the last few years, but it seems so predominant anymore that you almost think it's been around forever. It might be interesting to kind of maybe set up a little bit of a historic perspective. When was the summit founded, and why was it founded? And maybe, obviously, I think most of us understand what the mission is, but from your perspective, what's the mission?
Absolutely, Frank. I think those are great questions and a good level set to get started today. The Health IT Leadership Summit was created in 2010, and it was created by 3 partners, the Georgia Department of Economic Development, the Metro Atlanta Chamber, and the Technology Association of Georgia's Health Society. The summit is really an opportunity to bring together leaders from across the healthcare continuum to discuss different ways that the industry can drive innovation, enable better healthcare delivery at lower cost, and to more people.
Well, you know what? Go ahead.
I'm sorry, go ahead.
No, please go ahead.
The Leadership Summit really, as it was conceived to be an annual event that is designed to promote collaboration and idea sharing, for all of the health industry leaders in this very important economic cluster that exists here in Atlanta and in Georgia.
Well, I'm glad you mentioned 2010. Again, it has been a few years, but we've been blessed with the opportunity from our company's perspective to have worked with each one of the events over the years. We've done a lot of the actual video capture and video production work that was done at the very beginning. And the reason I bring it up, it was almost a spontaneous combustion. You know, it was I often say phantasmagoric. It just seemed like a magical chemistry of things that were planned as well as things that were meant to be, because when that group got together, something sparked, something happened, and it either validated what was already going on or actually was the moment of the beginning of really the heavy growth and expansion of the health IT industry as far as the state of Georgia is concerned. Maybe from your perspective again, what have been some of the outcomes?
Well, I think a couple things. Let me step back to talk very briefly just about the importance of the segment there. That was really, again, back to why it was founded and the outcomes that are trying to be driven out of the summit, is the importance of that segment here in Atlanta. It is one of the largest in the nation. I think there's north of about 225 companies now that employ about 30,000 people in the metro area. In addition, I think that there's something north of, last I checked with the chamber, there's north of about $5 billion driven in revenue from the top 8 companies here in Atlanta. And so there's a lot to be passionate about there. Pat Williams, who is the board chair for the Tag Health Society, really lent a lot of passion and helped drive the passion of the founders to get this done. And to this day, a lot of the horsepower for driving the summit forward is provided by the Tag Health Society's board of directors, as well as their board of advisors. Some of the things that we're very happy to have as outcomes this year is, A, the continued evolution of the summit to provide, information and to continue to develop this health ecosystem. We have created a startup pavilion this year to really focus on some of the smaller companies, as well as an access to capital module in the afternoon to help those companies get hooked up with adequate funding to continue to fuel the segment in the future. Additionally, we've added on this year an internship parallel module where local companies can both be paired with all of our valuable educators in the area and learn about different ways or innovative ways that interns can be used in creative internship programs. Again, one of the outcomes here, too, is trying to continue to create a pipeline of well-trained individuals out of our educational system to feed and perpetuate this economic cluster. The Technology Association of Georgia, in conjunction with the Georgia Department of Education, does a Student Innovation Award every year, and this year is no exception. They have added on middle schools this year in addition to high schools. Those Student Innovation Awards get STEM students in the local schools and schools statewide involved in the summit, the creation of health IT and teaching health IT, highlight those, and then feature them at the summit as well. And that dialogue that was created with the Department of Education has led to an embedded health IT curricula now in the state of Georgia, so that we're really trying to get kids excited about the health IT area, educate them young, and create the future leaders for the segment. And to me, that's one of the most important outcomes of the summit to date, and that goes on year over year, continuing to develop that workforce in Georgia.
From a generalist looking into this particular vertical, I would look at it from sort of two parallel paths. One, the technological evolution, and then the actual result of that technology impacting higher quality, better quality of health and health care. Maybe address a little bit about, you've covered a little bit of the benefits of the summit as it relates to, from an economic cluster in Georgia and the Southeast, but maybe go into not so much the summit particularly, but the subject of health IT. From your perspective, how is it impacting overall technology and the evolution and growth of technology? And, of course, how is it impacting better health care?
Absolutely. The event theme this year for the summit is the transformation of healthcare delivery. And one of the things that we really wanted to tackle this year is, as we do face major changes in healthcare in 2014 and the future as part of the implementation of the Affordable Care Act, that we feel there is both opportunity and the need to create the path forward for healthcare in the nation. And one of the things that we like to focus on and wanted to focus on this year then were the innovative and disruptive uses of health IT to bring care to the point of care, or I should say bring clinical care to the consumer, where the consumer is, much like cell phones revolutionized communication in that you are not tied to the location to speak to anybody. Your cell phone then follows you. We really believe that as healthcare continues to be consumer-focused, it will be delivered where the consumer is, whether that's at home, in the workplace, in their car. And some of the technologies that are allowing clinicians to bring healthcare to consumers and consumers to access the quality clinical care that they want are being developed. Those products are being developed here in Atlanta by local Atlanta companies, whether they're hardware, software, or innovative clinical delivery models that our providers have put together. So we're very excited about examining all of those, looking at those, highlighting those, and creating a dialogue, again, in the space vis-a-vis the summit so that industry leaders, providers, payers all have a chance, and educators, to talk about what's going on. Where is the leading edge? What are the just really cool things that health IT is allowing us to do to leverage the resources we have to provide the best care possible in the future?
And of course, again, one of the things that we have the luxury here at Tech Talk is we get a chance to talk to leaders of every vertical. And so whether it's internet security or health IT, fintech, many times we often say that it's the same thing, only different, meaning that so much of the technology influence is fundamentally the same, whether it's high-speed connectivity, mobile apps, certainly now a lot's going into cloud computing and the ability of even the leveraging of what we used to call information turned to data, turned to big data, turned to analytics, turned to prescriptive analytics, I heard the other day. Now, not only projected analytics, but the reason I was bringing this up is that so many things that are happening in the healthcare industry are leading the way in other situations that most people wouldn't be aware. And, for example, I was talking to another company in a different vertical, and they were talking about electronic health records. And when it really got into a conversation, they were talking about fundamentally predictive analytics and the fact that a lot of what's happening in the healthcare market is eventually going to be leveraged in one fashion or another in some of the other verticals, and, of course, vice versa. So I think it's a case where partly my suggestion would be any of our members that are listening, if you are involved in the healthcare industry or if you're involved as obviously a professional practitioner, academic, this is an event you don't want to miss. The other side of it is that if you're involved in technology at all, some of the things that are going to be talked about, some of the things that are going to be explored, some of the things that are going to be recognized are things that you are either doing in your own industry or will be seeing soon impacting in some fashion or another what's happening in your particular vertical. Turner, let's talk for a second about can you grow something like this, or is it organic? Is it just something that in a way the best that we can do is try to keep up with the explosion? And if you can grow it, what are you doing to grow this economic cluster?
I got you. And let me also just back up a little bit, too, because I think that, to your point, that the technology is applicable across verticals. And so it is exciting to hear what's going on. And part of the design and the intentional design of the summit is to talk and take a 15 to 20-year look out through our featured speakers. This year it's Jonathan Bush from Athena Health, to look at what is possible and set that table. and then through our executive panel and some of our information content sessions through the morning, looking at what is the 5 to 10 year roadmap. Okay, so if this is what's possible, this is what my roadmap should look like. And then finally in the afternoon through our 4 content modules, really drilling down and saying, okay, what can I do today to push my business along? But it is important, and it's interesting because I believe that it remains relevant to technology across verticals. It's simply innovative application of that technology.
Well, 10 years, it's funny, everything is so 20 minutes ago. You can't really say what do you see in a trend over the next 3 to 5 years when you talk about disruption, and that's become a ubiquitous terminology anymore. It seems like everything is disruptive, but everything is rapidly hybriding and changing. One of the things that I think about in terms of a vertical that goes horizontal across all of the industries is cognitive computing, and you think in terms of Watson and artificial intelligence and the role it's going to play at some point. I would say clearly in the health industry, but certainly as we, even in retail for that matter. So again, I just think that so much of what's happening is important for all of us to be exposed to and to begin to get a general understanding of the mosaic, if you will, and certainly best practices and idea sharing and collaboration at the, let's say where the tire meets the road, where the industry is involved in actually delivering these kind of things in a real-world, real-time situation. That's the critical need and the critical benefit of the summit. But there's so many extra added features to it that again, I just think that it has become, without question, one of the premier, if not the premier events of the year as far as Atlanta is concerned. And I would even think beginning now to become a factor in the Southeast. I've kind of mentioned it a little bit. Reinforce it if you agree with me, and that is, who should participate in the summit? I mean, is it only hardcore practitioners? And if not, who would be some of the others that you think should consider the possibility of attending?
No, our typical audience at the summit, is a wide variety of attendees. They typically include senior leadership from key stakeholders, and again, when I say key stakeholders, this is not just clinical providers. This is our payers, our product manufacturers, some of our the clinical practices as well, of course, but stakeholders from across the healthcare industry, and then additionally all of the industries that touch into healthcare. Health IT vendors, providers, insurance companies, government, academia. We have a strong academic and educational focus and continue to promote the workforce development. Large employers, we have a number of community partners and community organizations, nonprofits that participate and attend. So I don't know that I can pigeonhole real well or give you a thumbnail sketch of what the audience is, because it's so wide and varied.
I think that's a stronger message. I think, unfortunately or fortunately, in a short period of time, what used to be silos and isolated from each other have become now these opportunities for idea sharing and innovations, collaboratives. Just over the weekend, I was involved in what they call a hackathon, which, once again, one of the things we're challenged with is semantics to keep up with technology. Obviously, everybody reacts to the word hacking, and in this particular case, what they're talking about is dynamic problem solving using programming and technological engineering capability. And what they're doing now is literally setting up a competitive environment on a high speed, 24 hours, 18 teams, challenged with a problem. End result at the end of the 24 hours is the announcement of several suggestions and a prize. When you talk about that kind of collaboration, they call it open innovation, the way we used to talk about open source just a few years ago. I think the same thing holds true for the Health IT Summit. I think it's almost an open resource, if you will, that everyone should participate in. I'm going to suggest that if anyone wants additional information, I'm sure there's plenty enough time to register, maybe even some time to consider if you're interested in buying a table or participating in some form of underwriting or sponsorship. I'm going to assume that's still available, Turner.
We'll certainly make that happen, yes. And
the location is healthleadershipsummit.org. Am I correct?
Yes, sir.
Okay, that's again healthleadershipsummit.org. And Turner, thank you so much for for the exciting things that you're involved in and your participation in the summit, and for taking time out of your busy schedule to join us for a few minutes to talk about it here on Tech Talk.
Well, I appreciate it, Frank, and we really look forward to seeing everybody November 20th at the Renaissance Waverly. Thank you, sir.